the adolescent survivors, there's some reports of traumatic stress. About 5% report current PTSD. 8% report some post-traumatic stress disorder since cancer diagnosis. But this is very similar to the same rates of post-traumatic stress that we see in kids who have gone through, say, a hurricane or some other kind of natural disaster. Whereas the rates we see in the parents is more similar to people who have gone through some kind of like a violent crime. So being held up at gunpoint or something like that. There are still symptoms, though, the adolescent survivors report. So nearly 3/4 say that they experience at least one symptom of re-experiencing. 41% say that they report at least 2 symptoms of arousal, and again, 16% report 3 symptoms or more of avoidance. These survivors report a positive view of life, good self-esteem, and a broader perspective. They also report enhanced maturity, greater compassion and empathy, new values and priorities, and new strengths. And some of our data show that about half indicate a positive change in how they think about their life, and 42% indicated a positive change in their plans for the future. In some of our intervention research, we get families of survivors to come together and talk about their experience. And in one discussion, we had an adolescent survivor say, "I wouldn't trade my cancer experience for anything. It made me who I am today. And if I could go back and they could say, you don't need to have cancer, that's not what I would choose." And the parents in the room were like, "How could you say this?" But it became part of who he was. And he accepted it and really showed this enhanced functioning trajectory. Young adult survivors of childhood cancer don't show elevated rates of anxiety or depression, but it does seem that they show a little increase in the kinds of traumatic stress symptoms that we're talking about. So instead of these low rates of 5 to 8% reporting post-traumatic stress, there's about 20% of young adults who report enough symptoms to qualify for the diagnosis. And if you look at these numbers for re-experiencing arousal and avoidance, what we see is the percentage that are having 3 or more avoidance symptoms increases. So these young adults feel maybe more anxiety about the situation, but we're really seeing this in they're more likely to avoid cancer-related anything, actually. So we're seeing this little bump up in post-traumatic stress. Now there's some thought that this occurs because young adults for the first time become wholly responsible for their medical care. And maybe for the first time they realize and conceptualize what they went through. In terms of the siblings and the whole family, family patterns that are created during treatment, where the child with cancer was the focus of attention, may continue after treatment ends, and that might continue to marginalize siblings. Among siblings of childhood cancer survivors, about 1/3 report moderate to severe post-traumatic stress symptoms. So that's greater than the survivors themselves. But siblings also report many positive outcomes. So just like the survivors, they report enhanced maturity, responsibility, independence. They also report more empathy, thoughtfulness, and compassion. So, in summary, distress is greatest at diagnosis for most people, most family members, and improves over time, reaching near normal levels by about 2 years post-diagnosis. But there is still a subset of family members who have problems. Parents report the most distress within the family, followed by the siblings, and the child with cancer seems to function quite well, especially when we look kind of at a broad scope across time. Evidence of symptoms of post-traumatic stress and traumatic growth has been found across all of the family members. So now a little bit on helping your family cope. Based on this model of traumatic stress and what predicts who gets more traumatic stress symptoms, there's a number of recommendations that we can make. of all, it's important to be patient. And you need to be patient with yourself, with your family, and with treatment. So it takes time to learn everything that you need to know about cancer, about treatment, about the medical system, about late effects, about how to negotiate this long journey. It takes time to adjust emotionally. It takes time to understand the reactions of family members. It takes time to understand why are they doing what they're doing and what is really behind what they're doing. It takes time to find the best way for your family to work together and support each other, and then also to accept the uncertainty. For the most part, we know with time it gets better. It's also important to help your children. And here I mean both the patient and siblings. It's important for children to understand what is happening. One of the reasons that we believe that children with cancer do so well is because we have so many supports put in place for these kids. At CHOP, we have child life, we have social work, we have access to psychology, we have caring nurses, we have physicians, and they're all focused on this kid. Still, you're a very big player and the most important player in their team when it comes to helping your children. So it's important to talk to them. It's important to be age appropriate. And I know you probably hear that over and over again and people don't tell you what that means. Well, I'm going to try to tell you a little bit about what that means. Young children, so those below age 8, probably don't need a lot of detail. And they don't have the patience for it. So they need just the basics. Across the board, all children need to know what's going to happen physically, how are things going to look different, how am I going to feel different, what do I expect next, and how is this going to change my routine. The changes in routine, that's something that is very important to siblings. They want to know who's going to be taking care of their needs. It's very important to be reassuring and supportive. Kids need to know this is not punishment. Both siblings and children with cancer may think, I did something to cause this, and now I'm being punished for it. Kids also need to know it's not contagious. They need to know they're not going to be abandoned. Again, very important for siblings, but also children when they're in the hospital, and that their needs are going to be met. It's important to be sensitive to the preferences and style of your children. So we all know there are some people who need more detail and need more knowledge, and others that don't. Some people that need to prepare far in advance, and some that want to know 5 minutes before it's going to happen. And you and your child may be different in those regards. So make sure that you're providing and talking to your kid in a way that you know is best for them. Be honest. And this is very difficult. There's always a way to tell the truth to your kids, and that helps them prepare for what's to come and builds trust. And finally, in talking to your kids, you need to be open to their questions and know that you don't need to have all the answers right away. You can say, I don't know. I'll find out and get back to them. It's also important to remember that having conversations with your kids is not a one-time event. It's something that needs to happen again and again. And throughout the course of treatment, it's something that needs to happen differently at different developmental stages. And it doesn't need to be kind of a sit-down, drag-out kind of talk. It could be something that happens during a basketball game or on the phone. It's always important to check in. It's important to share your feelings with family and friends. It's important as individuals that we recognize how our thoughts and feelings impact our behavior with others. If we're feeling particularly irritable, particularly scared about something, that comes across in how we interact. It's important to know where that's coming from. It's important to talk about how you feel. It's important to share your feelings with and encourage your children to express their feelings. If you express your feelings to your kids, they're more likely to believe that it's okay and to know it's okay to express their feelings to you. It's important to remember that positive emotions are okay. This is something that siblings particularly need to know. It's okay to laugh, it's okay to feel good, and in fact, that can be restorative. Having those positive emotions can help you build up more resources and give you a break from the negative and help you go back in again to deal with everything you need to deal with. And it's important to accept the feelings of others. There are no feelings that are wrong. It's important to rely on other people to help you and your family. And there are many other people who are willing and able to help. So the medical team can help educate and prepare you and your children for what's to come. They can provide emotional support. Extended family can help. They can be in there helping you to maintain your home. They can spend time with healthy siblings. They can even become involved in medical care. Friends, neighbors, and community members can all provide support to your family. And the school can help as well. It's important to have a list of things ready when people ask you what can they do, because they don't know how to help. And they need concrete tasks that they can do and actually like that best. It's important to not try to go it alone. It's helpful to establish routines and maintain rules. Consistency helps in a lot of different ways. So if your family is consistent and has rules and limits, that can offset the unpredictability of the cancer. It can allow children to feel more safe and secure. Kids sometimes read into things, you know, if suddenly they don't have a bedtime anymore, that might make them scared. It's like, okay, if the rules are out the window, there must be something pretty bad going on here. So those types of limits and rules actually make them feel more safe.